everyone. Thank you for joining me in today's very short lecture entitled No Drug Like Me, a short lecture on the basics of chemsex and harm reduction. The legal consequences of illicit substance use pose a barrier to the prevention and treatment of HIV and AIDS. Individuals concerned about possible punishments for illegal drugs are less likely to come forward for treatment. This environment creates a cycle where people are more likely to engage in risky behavior as a result of their drug use, and they are more likely to remain in their environment out of fear of punishment. So I will be requesting for everyone who are here, let's practice kindness, not only for others, but also to ourselves when we're learning perhaps a new information or perhaps even an information that makes us a little uncomfortable. Part of crisis management for substance use disorder professionals is to manage one's own level of stress when dealing with a client in crisis, maintain professional boundaries, and make appropriate referrals. Use self-care strategies to maintain one's own well-being. Programs should have procedures in place for counselors to debrief with the treatment team and their supervisors. So this probably sounds very familiar for most of us. Okay, let's make this a little bit more interactive, and we'll do this very quickly. I will only be showing the questions for a few seconds. Please type your answers on the chat box. What does PNP mean in the context of chemsex? Type your answers in the chat box. What does H&H mean in the context of chemsex? Give an example of a drug or substance used during chemsex. So any substance you are familiar, you know of that's used during chemsex. Maybe you've provided counseling or even given a talk about this. Maybe you've heard about it in the news, perhaps you read about it, maybe you joined an international conference about chemsex. So what substance or drugs are usually used? Among what group or key affected population is chemsex most common? Type your answers in the chat box. Among what group or key affected population is chemsex most common? What is booty bumping? Booty bumping. What is slamming? What is slamming? What is barebacking? Bareback. What is barebacking? Why do people participate in chemsex? Why do people participate in chemsex? Do you have any ideas? Have you read maybe a study or a research about this? Perhaps listened to a talk about chemsex before? Why do people participate in chemsex? What are the risks of chemsex? What are the risks of chemsex? All right, so answers. What does PNP mean in the context of chemsex? So party and play. What does H&H mean in the context of chemsex? High and horny. An example of drug or substance use during chemsex. So shabu, E or ecstasy, GHB, poppers, special K, and C. So these are their street names, and later on we will be talking about the experience of using these substances and harm reduction strategies that someone who participates in Chemsex can explore. Among what group or key affected population is Chemsex most common? So MSM. What is booty bumping? It is also called boofing. It is a way to consume drugs by way of your butt. What is slamming? Injecting drugs. What is barebacking? Anal sex without a condom. Why do people participate in chemsex? The common words that you will be hearing for this morning's lecture would be pleasure and euphoria. But there's more to this. What are the risks of chemsex? Risk of STI, HIV, hepatitis C, overdose, drug dependence, mental health issues. Now, what is chemsex? It is sex between men that occurs under the influence of drugs taken immediately preceding and or during the sexual session. So historically, chemsex has been coined to be used between sex among MSM, and there is an intention to use drugs. Why engage in chemsex? Different from generic recreational drug use, these drugs can cause hypersexualization of feelings. Use drugs to connect, better sex because these drugs reduce inhibitions and increase pleasure, help to build instant rapport with sexual partners. So again, pleasure and euphoria, enhancing emotional intimacy and sexual connection, very much related to disinhibition, increase sexual confidence. Chemsex can take place in private homes or sex parties. Chemsex can be between two partners or with more people. So remembering our term earlier, PNP, H&H, chemsex, the use of select psychoactive drugs to enhance sexual experience, typically among men who have sex with men. It is associated with sexual behaviors with higher STI risk. Understanding patterns of chemsex among MSM, as well as the characteristics and sexual health service engagement of chemsex participants is most important for developing intervention. So psychoactive drugs are substances that, when taken in or administered into one system, affect mental processes. We will be focusing now on the commonly used drugs during chemsex, modes of administration or consumption methods, sexual experience, and harm reduction. Meth are stimulants, a type of drug that lets people stay awake and do continuous activity and less need for sleep. That's why for some chemsex participants, they indulge in binging. How is this commonly used or consumed? Smoked, injected, booty bump, swallowed, snorted. So sexual experience. What does someone experience? Having more sex and for a longer period of time temporarily addresses loneliness, temporarily addresses self-confidence issues. Someone feels sexy and connected. And again, binging can continue for 3 days up to 2 weeks, but with rests in between. How can someone reduce harm? Proper meal, fluid intake, no sharing of needles or equipment, rest. More harm reduction strategy or measure. Injectors should dissolve crystals in a separate container and use a filter to pull up the liquid. As much as possible, again, no sharing of equipment or paraphernalia. Okay, ecstasy. Ecstasy is very popular in the party scene. No? So PNP, H&H. Ecstasy is a stimulant drug that can cause hallucinations. It is known as a designer drug because it was created for the purpose of making someone feel high. The drug is popular with teens and young adults who go to clubs, concerts, or rave parties. This is commonly swallowed or snorted. Euphoria, increased energy, sexual arousal are the main, heightened sensations that someone experiences. There's an increased instant pleasure, more comfortable with vulnerability, can make someone feel more connected and present during sex. Heightened emotional intimacy stimulates libido and enhanced vaginal lubrication, feelings of sensuality or deep emotions. It can produce experiences of emotional communion, oneness, relatedness, emotional openness. One of my very first experience of providing basic counseling to someone who participates in Chemsex is his main concern. He only feels connected to someone when he is using drugs or when he's high on drugs, and particularly when he's in a party or a club. So that was a struggle for him to stop, because his main concern is he didn't want to feel lonely. Harm reduction, fluid intake, proper spacing for follow-up dose, risk of dehydration, but there's also risk of overhydration. Before taking a full dose for the first time, it's suggested that you first take a quarter dose, especially if for those who are already having conversations or plan to use it, or they've tried it before and that they are planning to use it. So sometimes this is called allergy test. So there's really, but it's in reality, it's very, very difficult to actually determine the exact dose. Harm reduction again, drink water over each hour period. So maybe 250 to 500 ml of water. GHB, like MDMA or ecstasy, GHB is popular with club goers and at rave parties. When mixed with alcohol, it has a depressant effect that can cause someone to black out. This is why GHB is often called the date rape drug. It is often swallowed, often combined with alcohol or other beverages. Sexual experience includes euphoria, disinhibition, enhanced sex drive, sociability, anxiety reduction, produces experiences of emotional communion, oneness, relatedness, emotional openness. Since it is colorless and tasteless, it is considered a date rape drug. So later on, we will just a little bit talk about consent and protection. Harm reduction, avoid alcohol, avoid mixing with alcohol. But again, in reality, this is challenging. Avoid taking with other depressants, properly timed second dose, education on safer use. More harm reduction strategies or approaches. If the person is awake, get them to sit and keep them awake by asking questions in a loud voice and shaking gently if you feel comfortable. If they are struggling to regain consciousness, try pinching on the shoulders or rub your knuckles over their chest. Judge their response and call for help if they deteriorate. Wait with them for them to fully recover. If they are unconscious or not responding, call for help right away, as oxygen to the brain may be reduced, resulting in brain damage. Roll them over into the recovery position on their side, especially if they are vomiting. Check breathing periodically. Simple things to be safer: eat beforehand, stay hydrated. If necessary, sip a sports drink for faster rehydration. But water is enough. If you know, because chemsex, again, there's an intentional use to have sex and use drugs. So from my counseling sessions with chemsex participants, they plan this. They plan this on a weekend, once a month, once every 3 months. And these are the types of conversations that can happen. Mixing G with other drugs can increase risk. Steroids and alcohol are like considered other drugs. It's easy to become dependent. The more you take, the more you need to feel good. Break your use. Daily use is a quick path to dependency. Avoid going cold turkey. And so some people struggle with the feeling of withdrawal or feeling very, very down. Poppers, commonly referred to, yes, poppers. These products contain chemical substances similar to the prescription medication, which is prescribed for the relief of chest pain. So it's a liquid chemical sold in a bottle and usually inhaled. Experience with poppers: lowered sexual inhibitions, relaxation of anal sphincter, euphoria. Inhaling poppers increases blood flow to the body, giving some users a head rush that lasts for a couple of minutes, a sense of euphoria, increased sex drive, and skin sensitivity. So a lot of times it's reported to me while they use poppers, this head rush is very, very immediate. So there's also a possibility to feel sick and faint, uncoordinated physically. Someone can also experience nosebleed, headache, or chest pains. Educate on the proper use. Do not get on skin. Avoid flame if also smoking. Promote condom use even when on poppers. But again, in reality, this is very challenging. That's why having an open and safe conversation is very important. There's a chance to have a clear discussion on how to prepare the condoms, like have condoms around. When you talk to one partner or several partners, chemsex participants, how they would organize their chemsex session. So there's also such a thing called organized orgy. Do not use poppers with Viagra or other erectile dysfunction drugs. The interaction between these drugs may be very risky since it can lead to a significant reduction in blood pressure and possible fainting. Communicate with your partner before using poppers. Make sure you're in a place where no meth or other addictive substances are available. If you are worried that using poppers can lead to unwanted addiction to other substances. If it touches your skin, rinse it off immediately. Contact with the skin can cause irritation and lesions. Consent and protection. Poppers can affect your judgment and may increase risky sexual behavior. If you are planning on being intimate, have conversations about consent and protection before use whenever possible. Ketamine is a quickly acting anesthetic that is legally used in both humans and animals. At high doses, it causes intoxication and hallucinations similar to LSD. When misused, injected, snorted, smoked, swallowed, Prescription formulas are injections or nasal sprays. Sexual experience with K. Pain-relieving properties can make you feel detached, dreamlike, relaxed, happy, confused, or nauseated. It can alter your perception of time and can stop you from feeling pain. So yung mga hindi na napapansin kung anong oras na can also lower inhibitions and may increase the likelihood of you taking risks you may not otherwise have taken. Euphoria, trippy feeling, less control over motor skills, so uncoordinated. Start with a small dose. Don't combine with downers. Both alcohol and ketamine may be known to be used at clubs and parties. But that doesn't mean that they pair well together. In fact, it can be life-threatening to take both, and accidents can easily happen too. A person who has taken both should not be left alone. Always have a sober friend on standby for any situations that may arise. Medical attention may be required if any of the following signs and symptoms are observed after taking this combination of drugs. Action should be taken quickly by calling the emergency services. This is in an ideal world, but we do not live in an ideal world. In the real world, Chemsex participants are afraid to call someone. For some of them, their closest friends or their best friends are even their partner, their jowa, may be unaware of them participating in chemsex. So if it's an organized orgy or if they have one or two regular partners, this is a conversation that can happen. And hopefully a conversation that can also happen between provider and patient or counselor and client. So in terms of educating as a health provider to your patient, a counselor, an advocate, a peer educator to your client, these are some of the things that can be discussed, no? If your client is considering to use K and E. So symptoms to watch out for. Again, telling someone, even if, for example, as a health provider or as a counselor, you may be unfamiliar with the chemsex scene. But if you already have an idea and someone has opened up to you after building rapport and trust, you can be that someone they tell. Like if they're planning to do it, if they're curious about it. So later on, we'll be talking about the types of drug use, and part of that would be recreational and even experimental. But if they're already there in the scene and if they feel overwhelmed in the venue, call a friend to get you and then stay with them overnight. Be aware of side effects, and there is recovery time. So for some screening tools or intake forms, there are actually questions about social and legal obligations, because some people end up missing a work day or missing out on family or important personal obligations. Cocaine is a stimulant, which means that it produces a fast, intense feeling of power and energy. Then it wears off and the user feels depressed and nervous and craves more of the drug to feel good again. So might feel down, might feel depressive. It is usually snorted or sniffed, smoked, injected, swallowed, rubbed into gums. Intensifying the pleasure makes someone horny and sex is more intense, increases libido, feel closer to the person, increases energy, less likely to use condom and lube to protect oneself because the feeling of euphoria is already very high. Harder to come, might cause abrasions on penis or anus, self-confidence boost, sociability, sensitivity to light, sound, and touch. Avoid mixing with alcohol, avoid binges, avoid sharing paraphernalia, equipment, syringes. So avoid all of those. Types of drug use: recreational, experimental, dependence. So we'll also be defining the difference between substance use and then up to when or what is the difference between SUD, substance use disorder, from someone's substance use just once ever in their life. Gumamit sila ng isang beses nung high school sila, nung college sila, hindi na sila gumamit ng ecstasy ulit. Crisis management for professionals, not only substance use disorder professionals, but also peer educators and counselors and healthcare providers. Harm reduction, Chemsex self-care. Types of drug use: recreational. So this again highlights pleasure and euphoria. Again, it highlights also party and play, H&H. Experimental, curious, very much related to recreational. You saw someone use it in the club. Maybe that sparked curiosity. Dependence, persistent and excessive use of a psychoactive substance. Substance use is any consumption of alcohol or drugs. Something as commonplace as having a beer with friends during dinner is considered substance use. Substance use may not be a problem or lead to abuse or dependency in some people. Substance abuse is when someone continues to use drugs or alcohol even when it causes problems such as trouble with work, family, or their health. For instance, continuing to use drugs, knowing you'll be fired if you fail a drug test, is a sign of abuse. In reality, it is very difficult to determine if it's challenging to determine sometimes if it's just a use or abuse, because it will take a while for someone to open up and to give clear information. That's why linking to care is one of the best practices. Substance use disorder includes the following signs and symptoms: using substances in larger amounts for longer than intended, making efforts to stop but being unable to do so. These are also a few of the questions that are asked in screening tools. Spending more time getting, using, and recovering from using the substance, having cravings and urges to use the substance, and so much more. Harm reduction is what we do to make sure that when bad things do happen, they are less catastrophic. Fire sprinklers in buildings, seatbelts, and needle exchanges are all about making the consequences of something bad or unhealthy less terrible. If someone has decided that they want to engage in a Chemsex session after checking pros and cons, and they are determined to do it, it's very important to remember that in those scenarios, sometimes bad things may happen. And many of the effects of those challenging experiences can be avoided or at least minimized. This is the aim of harm reduction in Chemsex. Harm reduction principles: pragmatism, having a conversation, having an open and safe discussion. Human rights has a lot to do with consent and protection. It is important to work in collaboration or in partnership with some agencies, even advocates, lawyers. Focus on harms. This is when education comes in. Maximize intervention options. Reviewing, studying, discussing with your team on what crisis management you have in place in your facility, what screening tools you have in place already. If none yet, these are a few you can consider: SBIRT, DAS, ASI, ASSIST. So SBIRT is very, very common. Screening, brief intervention, and referral to treatment. And later on, you will see a very, very short demo on what questions are asked for screening tool like ASSIST. Priority of immediate goals: be clear and specific. Drug user involvement, so the Chemsex participant have a non-judgmental approach. So notice how you feel about it, and also observe how you talk about it. Chemsex self-care. This can be described as ways for people who engage in chemsex to remain in control. These may come in the form of managing triggers, controlling cravings, or altogether abstinence. Basically, these are tools that can help in managing their experience and ensuring their safety, or adding safety measures. Remaining in control of chemsex and your relationship with sex and drugs can sometimes be challenging. Using chems can be a way to forget other issues and challenges we might have in life. For example, how you feel about yourself, your sexuality, HIV status, and negative experiences of discrimination or coming out can each be challenges we use drugs to cope with. When you are using something to cope with issues in your life, it can be difficult to reduce the chems you take or to change your relationship with chems, especially if you feel that you benefit from using them. Some chemsex self-care may be in the form of sober sex, identifying the change you want to make. This can happen in a facility, in a counseling session. Abstinence or stopping altogether might prove difficult in the beginning. Having the support of a family, your partner, your jowa, the support of your healthcare provider, these are all very important factors aside from someone's internal motivation to stop altogether. Reducing chemsex. Right now, I'm providing counseling to someone who makes himself busy or productive in the workplace. So he avoids planning chemsex over the weekend. One of the things he has done, aside from getting employed, he's just recently gotten employed, is to open up a business. And when he's focused on his work, there's less chances for him and less opportunities to plan chemsex, to plan participating. Discuss with your team, your counseling, and your crisis management in the facility. So if possible, arrange a face-to-face interview with the client in a safe place for both the client and the counselor as soon as possible. When meeting with the client, make sure you both can easily exit the area. Do not block the exit with a desk, chair, or other furniture. Whether dealing with a client in person or over the phone or other platforms like Zoom, help the client make a clear plan for getting through the crisis. The plan should include time-related goals or target dates. This might be challenging when starting a conversation. It usually takes a while for someone to provide you with specific, clear information. This is also why screening tools can be useful. Help the client set clear and achievable short-term goals. If possible, involve significant others to offer support. Further discussions in your facility to reduce risk or reduce harm. In Chemsex, this entails creating measures to avoid developing substance abuse disorders when engaging in Chemsex. You might also be curious, interested, or already learning, or already part of your practice. PrEP, PEP, you're probably an educator, or you probably discuss with your patient U equals U, ARV adherence. We'll proceed watching a very short demo video. So there's an introduction about the type of screening tool that's used and very, very few examples of open-ended questions. After that, we can proceed with Q&A.